Going right to go? Good, thanks so much for joining us. I'm joined by Naomi Bromley, Deputy Secretary for the vaccination program, and Professor Rhonda Stewart, the Director of the South East Local Public Health Unit, who's going to talk to us about boosters and the value and importance of that third dose. And Naomi will talk about a big weekend ahead, trying to get those third doses into as many arms as possible. Some numbers of the day first, before I make some announcements. 25.9% of Victorians 18 and over have had their 3 doses. That's an increase from 24.8% yesterday. The number of 12 and over who've had their 2 doses remains at 93.2%. 22,121 doses were delivered yesterday at state sites. That's 5.3 million doses that have been delivered in total. 5,142 of those 22,000 were for children aged 5 to 11. So we again congratulate and thank parents for the sheer numbers of young people who've been coming through getting their paediatric vaccine. Obviously we want to see all of our kids 5 to 11 getting the protection of a free, safe and effective COVID-19 vaccine, and there are appointments available. To that end, I can confirm that there's 104,000 bookings that have been made in the last 7 days. 68,000 of those for third doses or booster doses, and 33,000 of those were for a first dose for a 5 to 11-year-old. So it's busy. There's lots happening in our state hubs, and of course there's also lots happening in GP practices and community pharmacy. And that's why our grants to support those businesses to change their business model and to do more of this work that's not so much for profit but for public benefit. We're very, very grateful to those who are participating in that program, as well as more broadly to every GP and all their team of staff and every community pharmacist and their teams as well for the critically important role that they are playing. There are booster shots available, there are paediatric doses available, there are even first dose and second dose appointments available across all 3 of those settings. Our state hubs, which have done an enormous amount of work, half the workload, when we'd only really committed to do about a quarter of that workload, but they've done a mighty job, as well as GPs and pharmacists. Between the 3 of them, it's never been easier in many respects to get a first or second or indeed a third dose. And we're very grateful to everybody who's running those important services. And of course, equally grateful to everybody who's coming forward and making an appointment, honouring that appointment and playing their part. There are about 180,000 appointments available for third doses at the moment over the next 30 days, and there are about 50,000 appointments available for children 5 to 11. So there are spots available, and indeed we're going to grow the total number of spots through the announcement I'm about to make. But just before then, there are 1,173 people that are in hospital. That's an increase from 1,152 yesterday. 125 people are in intensive care, and 43 and that was 127 yesterday, so it's down by 2. 42 are on a ventilator. Again, that's down by 1. And sadly, I have to report that 18 Victorians have died with COVID-19, 14 of those people in the last 2 days. And of course, we send our thoughts, prayers and our sincere condolences to all of their families. This will be an incredibly difficult time for them. In terms of case numbers, 10,043 people reported a positive rapid antigen test. A further 10,726 positive PCR results from 49,838 tests processed. That gives us a new case total for the day of some 20,769 new cases, and a total of 253,827 active cases, both PCR and RATs, across Victoria. Some 55,000 rapid tests were handed out across 76 of our testing centres yesterday. So there are significant supplies. Some orders have arrived. I'll have more to say about that process and a further update a bit later in the week. But to have 55,000 people able to access one of those tests at a testing hub, testing centre, is very important. As you've heard me say many times, and I'll continue to say it, there's two things that are critically important to driving these case numbers down. Firstly, to isolate when the rules require you to, and I say thank you so much to every single Victorian, every family, every person across the state who's had their summer. It's been a different summer, it's been inconvenient, it's been difficult, and it will remain so for a little while yet. But I thank everybody who's isolating, because that directly and really importantly reduces the number of infections and cuts off chains of transmission before they actually begin. So we're very grateful, very, very grateful to each and every one of those Victorians. And the second thing that is absolutely impactful is getting your third dose. And Rhonda can speak to that in more detail soon. So I'm very pleased to announce that effective immediately, the dose interval will be reduced to 3 months right across our state for your third dose. So if you've had your second dose within the last 3 months, then you will now be eligible. That is, you've had 3 months have passed since your second dose of the COVID-19 vaccine, you will be eligible for a third dose. That interval has been reduced down to 3 months effective immediately. That's on the advice of our public health team. That's consistent with the TARGI's broader statement. It's safe, it's effective, and it just means the total number of people who are eligible increases substantially by around 1.2 million Victorians, and it will help us to get more people third dose boosted quicker than would otherwise be the case. Just to give you a sense of the total equation, there's currently 1,365,004 Victorians who are 18 and over and have had a third dose. And with the announcement I've just made, effective immediately, reducing the interval down to 3 months, there are now 2.45 million Victorians who are eligible but have not yet had their third dose. So we've got a long way to go. It's a very impressive base to start from, and we're very grateful to all of those who've come forward and got their third dose, but there are indeed many more, twice as many almost, that need to go and get their third dose, and who knows what might happen to intervals beyond the 3 months. But at this stage, bringing that forward, consistent with what South Australia has done, consistent with what New South Wales has announced this morning, and I thank my First Minister colleagues, particularly New South Wales, for the cooperative way in which we've been working together to try and have settings that are as close to each other as possible. But again, we have adequate supply, so it's not like last year. We've got enough of the COVID-19 vaccine. We've got testing, we've got vax hubs set up right across the state. GPs are doing a fantastic job, so are community pharmacists, and the interval now is 3 months. So if you are now eligible, I'll just ask you, please come forward, make an appointment, honour the appointment, play your part for you, for the people you love, and for the people that we all count upon. Those people that we depend on every day, nurses, doctors, ambos, to take some of the pressure off them. There's really nothing more important than getting a third dose and going through that very challenging ISO if you or someone close to you has got the virus. Beyond the change to the interval, I'm also very pleased to confirm that this weekend we will have a booster blitz, and Naomi can speak to a little bit more detail about that. This is about opening up additional hours, so a number of our state hubs will be open longer hours. Also, there'll be a number of state hub sites where you won't need an appointment, you'll be able to walk up, and there will also be additional cubicles, additional spaces within those longer operating hours so that more appointments can be taken where appointments are indeed relevant. That's about a 60,000 boost in terms of capacity off a high base. So more appointments, there's plenty of vaccine, people can get their third dose sooner because we've reduced the interval to 3 months. And whilst we're starting to see some stability to these case numbers, I think we all know that there are more cases out there than are being reported. Nothing is more important than doing the ISO where you have to, but getting a third dose and getting your kids vaccinated through the paediatric program, really critical to us getting to a peak and then starting to see these numbers come off and then getting back to something like normal. We have very few rules on at the moment, but we do have many people who, for the best of reasons, and to stop the spread of this, we have many people that are not available for work, regardless of which industry. It's right across the board. And our health system is certainly not spared from that. We have many, many thousands of people who are not able to turn up for work, and we also have increased demand, more people who need hospitalisation, more people who need hospital care. That's why the Code Brown was announced yesterday. That's why I just want to send a really clear message to all of our health workers, regardless of what role you play in the system. All of us as Victorians are deeply grateful to you for your commitment, for your compassion, and for the role that you play every hour of every shift. It's so important. It's valued, it's understood, and we honour that work. And we do appreciate that things are very challenging in our health system at the moment, just as they are in Sydney, just as they are in so many parts of our country and indeed right across the world. The only positive sign here is that this is milder. It's not to the point of being insignificant. There are still many people in hospital and no one wants to get this Omicron variant, but it is not quite as lethal as Delta was. So we're seeing many people in general ward beds, less people than we might have thought in intensive care beds, but still it's a very big challenge for our health system. Everybody across that team is doing a great job, and I just also make this point. This is not about money, it's not about machines, it's not about effort. Everyone is doing their best, everyone is working their hardest. It's all about people. And if you have thousands of people who are highly skilled and highly competent that simply can't come to work, that affects the amount of service that you can offer. And it means we have to reorganise our health system so that the sickest patients get treated quickest and that the system works and supports itself across the board, one hospital supporting the next, all the way through. That's how the system works. And of course that also applies across the public and private systems. They're working very closely together and we're very grateful for that partnership as well. I might now, so this weekend will be a big weekend for boosters, and I'd encourage, I know people have been spending the summer as you would hope to. People have not necessarily been focused on going and getting a third dose. I've just asked people, it is so important. There are appointments there. There are walk-up opportunities. We've put extra staff on. The opening hours are longer. It's never been easier to go and get that third dose, and it's never been more important to do it. Please make an appointment. Please turn up and get third dose protected, because you're not just protecting yourself. You're protecting your family and you're protecting those people that we really rely upon, our nurses, our doctors, our ambos. You're going to make their job just a little bit easier. Not easy, but a little bit easier, and that's the most important thing. I might now ask Naomi to speak about that blitz and how the coming weekend is going to look. And then Rhonda's going to talk to us a little bit about just the value from a medical point of view, as a public health expert, just how big a difference a third dose makes. That's a well-made case, I think, but it's always good to hear from our clinical team just about some of the science that sits behind that. So over to Naomi first and then Rhonda.
Thank you very much, Premier. It's a huge milestone. The Victoria's booster dose interval has now reduced to 3 months, and it's vital that we made this change in our state-run system ahead of school and work picking up again in February. It means someone getting vaccinated this weekend will have their full protection within the first weeks of February. And to support that, we're delivering a 4-day booster blitz where Victorians will be able to walk up to our key vaccination centres, and there will be more space in the system for them to book ahead. It's never been easier to get your third dose through the state-run system or through primary care. If you got your second dose in October or before October, you can now come forward. When you go to the booking portal, there will be more appointments that you'll be able to see there. When you walk up to a state-run centre, there'll be more capacity, more cubicles, more staff, and longer opening hours. Over the 4 days of the Blitz, there are literally tens of thousands of appointments that are currently available, waiting for you to book in. For those who want to walk up, here's what I recommend. The Royal Exhibition buildings, with walk-up access between 8 and 8 for the duration of the Blitz. La Trobe University Bundoora, 8 till 8 over the 4 days of the Blitz. Sandown Racecourse, 9 to 6:30, Saturday and Sunday. Dandenong Plaza, 9 to 5, Saturday and Sunday. Frankston Bayside Centre, 9:30 to 5, Saturday and Sunday. Sunshine Hospital, 8 till 8 over the 4 days of the Blitz. Bendigo Vax Hub, walk up 9 till 8 over the course of the blitz, and the Ballarat Macua 8:30 to 3 on Sunday. Check the website. We'll also be listing out the wait times at each of those sites. So before you walk up, have a look on the website, see where you're going to go, and check in to make sure that the wait times are not too long. We'll try and keep that data updated for you. There are points of access across GPs and pharmacies all across the state too. Many, many more than there were when people were coming forward for their first and second doses. And we are incredibly proud of our partnership with primary care. We're proud to have delivered more than $3 million in vaccine enhancement grants to 263 GPs and pharmacies this month alone. $10,000 grants have been further awarded this weekend to help those grant recipients put on more staff over the Booster Blitz weekend, so they'll have even more capacity. In total, 106 GPs and pharmacies are putting on extra staff this weekend as a result of those grants. And we're also providing a special level of additional support to 2 large GP clinics. So the Inner North Medical Clinic and the Altona North Medical Clinic. And can I just really thank Dr. Shay Wilcox and Dr. Mukesh Hakawal, who are going to provide 6,000 extra appointments this weekend. We spoke to them both this morning. Many of those are already booked out, but they're 2 fantastic clinics, so I would really encourage people to have a look at and make a booking. As Professor Stewart will tell you shortly, getting your booster is so important. It gives you protection and it protects everyone around you. Victorians did an amazing job last year coming forward, getting their first and second doses, and that's given us really, really strong protection all across the board. But this immunity does fade over time, and so the third dose isn't really a nice to have, it's a need to have if you want to be as protected as possible as we head into the new year. 48% of people in Victoria aged 70 plus have had their third dose. That's good, but it's not really good enough. 37% of people in their 60s and 33% of people in their 40s and 50s. So we need to keep this going. We need to get those numbers higher. It's also really important to get your child vaccinated, just like I did over the weekend. And as a parent, it really was a great feeling to know that my family is that little bit safer. We're seeing around 5,000 kids come forward through our state-run centres and many, many more at GPs and pharmacies. Over 100,000 5 to 11-year-olds have now had their first dose in Victoria. We do encourage you to book for your child. There are over 50,000 appointments for 5 to 11s currently available in the state system over the next few weeks. And now I will hand over to Professor Stewart.
Morning, everybody. Just reflecting on, it's nearly 2 years since the first patient walked through the door at Monash Health, and where our journey began caring for COVID patients, and where we've all been going along for this ride. And we've learnt a lot over the last 2 years. We've learnt how to manage COVID, and we've learnt a lot about how to control COVID. And I think the most important lesson that we're here to discuss today is immunisation, and in particular, the importance of booster vaccinations. We know now that that is one of the most single important things that we can do for our community, is to get immunised. And we know now too that immunity post-vaccination is waning at around about that 3-month mark, which is why it's so important that the announcement today about bringing forward that time to get that third dose to 3 months is going to make a big difference to the community. Booster doses will decrease your chance of asymptomatic infection. They will decrease your chance of getting symptomatic infection, but most importantly, they will decrease your chance of being hospitalised by about 90%. And that is what we're driving here, the decreased chance of hospitalisation, the decreased numbers of deaths that we are seeing, not only from Delta, but more importantly now from Omicron, and Omicron cases are filling our hospitals. We are seeing many patients hospitalised across the health services, and we know that less than 5% of them have had a booster dose. So importantly, bringing out that message about the importance of booster dosing. Booster dosing is also really important after you've had COVID infection itself. We have recently reported on people getting reinfected with COVID. We know now that Omicron is 10 times more likely to reinfect somebody than Delta. And so now, more importantly than ever, a booster dose is required not only after your second dose but also after getting COVID infection. I've heard people talking, I've seen social media chats about maybe just getting COVID and getting it over and done with. My advice would be that is not the way to go. We are seeing people, young, fit, healthy people, being admitted to hospital with Omicron. We are seeing people being admitted to ICU with Omicron. But also we are seeing people very sick in the community, being bedbound, having high fevers, shaking chills, terrible muscle aches. I wouldn't wish that upon anybody. So my advice is get your booster as soon as you can. Now it's 3 months gap. Get a booster dose after you've had COVID infection as well. That will protect you because we know the immunity post-COVID disease itself is not nearly as good as what you will get post-COVID vaccination. So that message is pretty clear and I'll hand back to the Premier. Thank you.
Thank you, Professor. And Naomi, I'm happy to take any questions you have. Well, the Health Minister last Monday made a number of announcements in relation to third dose mandates for a number of different classes of worker. These matters are decisions that are made under a new Public Health Act. So, of course, with the pandemic-specific provisions of that Act, so I won't cut across those. But I've been pretty clear with people. There's every chance that we add to that list. For the best of reasons, we mandated a number of people, many people across many different sectors, a first and second dose, arguably. And I think you'll see very soon, out of national processes, you'll see the terminology and the recognition of the third dose be absolutely crystal clear. This is not an option. It's not an add-on. It's not a good thing to have. I think we're very close to a change in policy that will simply reflect the fact that in order to be fully protected, you need to have 3 doses. Not 2 plus an optional extra, but in fact to be fully protected, to be fully vaccinated, to have fully played your part, you need not 2 plus an optional third, but 3 doses. I don't rule out there being other groups that become the subject of a mandate. We did it for the best of reasons last year, and it's why we can all be very proud as a Victorian community that 93+% of us have had 2 doses. We've now just got to make sure that the numbers of people who've had a third dose continues to grow each and every day. That's what this weekend booster blitz is all about. Just a common sense thing, make it easier. Make it easier for people to get that third dose, and I think Victorians will absolutely do that. Sorry? Oh, look, we'd always like it to be faster, but it's a good solid base to build off, Rich. I think we just have to be out there pushing it as hard as we possibly can. That's exactly what we're doing. Extra opening hours, more cubicles, so therefore more appointments, and indeed some walk-up capacity so that people can just, if they happen to have a spare 20 minutes or so, because the queues are pretty short, particularly as we expand capacity, then they can drop into somewhere like the exhibition buildings and other sites as Naomi's just listed, and I think you guys have got, and we'd be grateful if you can help make that a feature of your coverage. I think the more convenient you make it, the more people will take it up. But we'd always be out there encouraging people, and just like we do for first and second doses, we're not happy to be at 93%. We want 94, 95. We want as many people protected by these vaccines, which are now, in practical terms, 3 doses. That's what will keep us all safe, and that's what will take the pressure off those people that we depend on the most. Our doctors, our nurses, our ambos. If you want to protect yourself, if you want to protect the people that you love, and if you want to say thank you to those people who we all depend on, the team that work in our hospitals, then get your third dose. Yep. Sure. Well, we don't rule out adding additional sites. Some places are. Well, it's not to say that there aren't already sites in those locations. There are. These have been expanded. Some sites are more easily expanded than others. Some sites have extra capacity. Some are already running at pretty full capacity. But we don't rule out doing what we did. And in fact, to a certain extent, in some ways, we are just repeating the same thing before with first and second doses. We expanded. Then we went to pop-ups, then we went to kind of micro pop-ups, getting really, really local. I was on with the supermarkets on Monday, and that's progressing very well, us taking the booster program to them, supporting them to get their workforce, which is obviously a critical workforce, to get the third dose. So we're engaging in lots of different ways. There's broad coverage across the board, and of course there are GPs and pharmacists as well. This is not just a state thing, it is a partnership with primary care as well. But certainly, Rich, we don't rule out both expanding the sites we've already expanded, opening new ones, having pop-ups and getting really, really localised. We want it to be as easy and as simple as possible for the maximum number of people to get their third dose. That's the most important thing. Sure. You are asking, as you're perfectly entitled to do, for a medical opinion. I'm going to let the medico in the press conference answer that. Did you hear? Yep.
Thank you. So after you've had COVID, your immunity will wane quite quickly. We know the immunity post-vaccination is much longer and higher than the disease itself. So yes, my advice would be that as soon as you're well enough after your COVID illness, go and get the booster vaccine.
Rhonda, can you be reinfected with Omicron? You get Omicron again.
So I guess we're going to be learning about that in the next few months, about if you can get Omicron and then get Omicron after it. We're living through this first wave of Omicron, and the immune response hasn't got a chance yet to give us understanding, but we will be looking overseas to that very important question.
Are there any reports overseas yet of that?
I have not seen any reports yet of that.
Certainly.
Sure. Yeah, I've been on the phone with the Prime Minister a bit the last few days, and I'm very grateful for the fact that there'll be a number of Commonwealth public servants continuing to support us at the Emergency Services Telecommunication Authority, so 000, helping with call taking. We know that that system is under significant pressure. They're not ADF as such, but it's not a matter of the uniform you wear, it's the role that you play, and they're doing a great job, and we've got some in there now, and that's going to be basically doubled, which is very good, and won't end anytime soon. It was scheduled to end at the end of this month, so I think that's going to be an ongoing arrangement. We're very grateful for that. In terms of ADF strictly, there will be, I think, in the order of about 20, and hopefully we can build to that over time. ADF personnel who, just like we very successfully did, I think, in 20 and in 21, certainly in 20, where we had an ambulance paramedic and a trained ADF member working together as a blended crew, so that the paramedic can provide the care and the ADF person who's trained to assist where appropriate, but principally to do the driving. That just means there are many shifts that'll get filled that wouldn't otherwise get filled. It just means many patients will get the care that they need as fast as possible. So I've been speaking with the Prime Minister quite a bit in recent times. Grateful for the answer, which I think came through yesterday or late the day before. And thank you very much to him and to his team. And we certainly don't rule out asking for more help if and when we need it. Well, it'll certainly free up the equal number. The other point to make here too, and again I had a very lengthy discussion with all of our Ambulance Victoria leadership late last week, Friday around lunchtime I think it was, where they've currently got about 600 people who are working, and whether it's St John's Ambulance volunteers who've done a bit of extra training to be able to perform those roles, lots of people that are stepping up to play those roles now to take some of the pressure off our ambos. But let's not, when we talk about healthcare, we often focus, as we should, on nurses and doctors, but let's not forget our ambos. They're doing an amazing job under very, very difficult circumstances. The secondary triage is very busy, so those who really don't need a 000 response but have come into the system via 000. So I just respectfully say to people, 000's for those time-critical emergencies. There are other pathways you can access, but secondary triage is there and working very well. And also some of that hospital in the home and those COVID managed pathways where we look after people at home. But our ambos are doing an amazing job, and anything we can do to take the pressure off them, and Ambulance Victoria leadership working with their workforce, working with the union, are doing many creative and innovative things, and they're doing their very best in unprecedented circumstances.
What about asking for ADF nurses? this call, and after that call, Greg Hunt did activate the private hospital.
Yep. Yep.
So will that assist, or have you thought about the ADF?
Well, the private hospital capacity is part of that agreement that we've got, that national partnership that we have with the Commonwealth, for which we are grateful. And again, you've got two different systems, but if they can work as one health service across the state, that's to everybody's benefit. In terms of the ADF, and again, I wouldn't want these comments to be read as being in any way critical of the ADF. They're not. But the notion that there are thousands of doctors or nurses in the ADF just waiting to be called up, that's not the way the ADF works. There are roles that can be played. There are supports that can be given. We're very grateful for the most recent support that's been confirmed. If we need, based on those constant assessments we make almost, well, every day really, if there's more that we need, then we won't hesitate to ask, and I'm sure the Commonwealth will give us a fair hearing on that, just as they are other states. The chances are, if you were to, for instance, if there was an agreement to send a whole range of health professionals from the ADF, chances are that the first thing would be done is a whole lot of reservists who are already nurses and doctors and ambos working in our system. They'd be called upon, and all they would do, Simon, is change their uniform. So we just have to bear that in mind. No one's got kind of infinite resources. And the other thing to remember as well is we've got thousands of staff in our hospitals who can't report to work for the best of reasons. Supermarkets are affected, hospitality, every media, every business, every sector is affected. And of course, the Australian Defence Force is not immune from that. We're grateful for the help we've been given. We're grateful for that which is coming very, very soon. And we won't hesitate to ask for more. And again, I'm very grateful to the PM for having confirmed that.
Do you think the Code Brown?
Well, that's not the advice. The advice is that this is not, and look, there'll be some who try to play political games with this. This is not about politics, and it's certainly not a game. This is not about money. It's not about machines. It's not about effort. Everyone is doing their best. Everyone is working as hard as they can. But this virus has infected or has isolated literally thousands and thousands of health workers. And healthcare is not provided by machines. Healthcare is not provided by, money either. It's provided by people. And if those people are having to isolate because a family member's got it, or they themselves have to isolate because they've got it, then they're not available to the system. And the health system is one of the biggest, if not the biggest employer in the state, and it is very, very challenging at the moment. That's why we've got a Code Brown on now. That's why the AMA have supported that. It's why the Nurses Union have supported that. It's why common sense tells you the system's under unique and unprecedented pressure. It is unavoidable in every way. It's how you respond to it. And doing that in a mature, system-wide way, following advice, making difficult decisions, very difficult decisions, but necessary decisions. That's how we'll get to the peak of these Omicron cases and then come down the other side of that and then be able to resume so many of the services that have had to be paused at the moment. Well, I'm not here to make any announcements about that major event or any major event, but what you can all be certain of, and what I think Victorians know, is that the government and Visit Victoria, we're out there every day working as hard as we can to get all the big major events to come to the major events capital of our nation. So if and when I have further announcements to make about any major events, then of course I'll be back before you to do that. Yep. Couple of points. Firstly, I'm not here to confirm that the role that rapid antigen tests will play in our return to school. And the reason I say that, Chanel, is there's a lot of work going on. We've been working very, very closely with New South Wales, but we all, as National Cabinet members, made a commitment at National Cabinet last week that we would do the work, we'd have a discussion tomorrow, and then there'd be announcements made following that. So I'll have more to say about schools. What I can confirm for parents, and I know parents are anxious, I know that teachers and staff are anxious, and I dare say students are also pretty keen to know what's going on. We will resume schooling day one, term one. It'll look a bit different. We're going to do everything we possibly can to make those schools as safe as possible. But in many respects, if you're a staff member, if you're a parent, go and get your third dose. That'll be making a significant contribution to the community and to the school community beyond that. And if you're a parent of a 5 to 11-year-old, please go and get your first dose, because that'll play a part also. We are going to do everything we can to make school as safe as possible, and I'll have more to say about the return to school and the detailed plans that are in place and that are being finalised at the moment, following the National Cabinet meeting tomorrow.
Does that include, though, do you have a problem providing rats?
Oh, sorry, just on the actual issue of the more specific issue, I would just draw your attention to the fact that the Commonwealth, out of the National Medical Stockpile, which I think has got in it or on order about 50 million rapid antigen tests. My understanding is that not last week but the week before, the Prime Minister committed to 10 million or the effective equivalent of 10 million. Some of it's in bulk, they're not actual kits, but they play the part of 10 million rapid antigen tests, and that they be distributed on a pro rata basis to the states and territories. I don't have an update exactly on where that's up to, but I'm happy to get it for you. So I wouldn't want people to think that the National Medical Stockpile is not being used. It is, but of course all of us are trying to source the same thing at the same time, and that's happening right across the world, and that means that there's some significant pressure. But the National Medical Stockpile is part of this mix, and if I can get you an update on the distribution of the 10 million, I'm more than happy to do that.
Has Victoria been requisitioning rats bound for South Australia?
I don't. I'm not aware of that. I don't believe that's accurate. I'm happy to check it out. One thing I'm certain, Rich, I'm not here today to have an argument with Premier Marshall. As I said, everybody's trying to source the same thing at the same time. And it might be in the eye of the beholder, whether something's been requisitioned or whether we just got an order in before they did. But let me check that out, lest I be having an argument with someone I've not read his comments. I haven't seen what he's had to say, but I'm happy to check that out for you. But we've got many, many orders in. We were the first to place orders, so you might say that we got in ahead of everybody. Maybe they're upset about that. I'll have to check that out for you. 44 we have on order at the moment.
Any of that, will that go towards frontline, i.e. Victoria Police, because they've got around that much?
Sure. I know there's yeah, sure. There's,
Because they haven't
yeah.
got a consistent rat.
Well, now hang on a minute. Just be clear.
That's what they do.
Yeah, sure. People are off work for a number of reasons, and even where there is absolutely sufficient supply of rapid antigen tests, not everybody who might be eligible to be exempt from the furloughing will in fact come back to work. And just think about that for a moment. Some people won't be well enough. Some people will be looking after kids who are isolating as well because there's a positive case in the household. So the notion that if everybody had a rat test, they'd all, just as a process of logic with absolute certainty turn up to work tomorrow, no, that's not the case, and that's not what we've seen so far, and it's not what we'll see at any point, I think. Every additional test that we are able to source means that there are more tests available for everyone else, whether it's in private industry, we work with, or with the broader government sector. We work with Victoria Police every day on these issues, and I might have them come back to you, or perhaps the Police Minister. Yeah, look, I want to say a couple of things on this. Over recent years, and particularly in the lead up to our announcements in 2014 of Australia's first public IVF clinic, which a lot of work's gone into, and we'll have more to say about that later on this year. I listened to so many stories, families, people going through their IVF journey, whether it be individuals or families. It's a very challenging, very, very challenging journey for anyone to go through. It's made even more difficult in the midst of a global pandemic. I'm sorry that these services have been impacted by the global, but I've heard so many stories from so many people that I know and understand just how challenging this journey is. I want to assure anyone and everyone, I want to assure everyone who's impacted by this that we're working as hard as we can to get day procedures back up and running. I apologise for these services having to be paused. Let's try and have them back up and running as soon as we possibly can. The other point to make, though, is that the most time-critical procedures within an IVF journey are still happening. But I'm not minimising it. I absolutely appreciate, and I've heard from so many people over a long period of time, many years now, just how challenging accessing IVF is, and even if you can get those services, just how much of a roller coaster, just how much of a challenge. It's a very, very difficult process to go through for so many. The pandemic has made it even harder. I'm sorry about that, but we will work as hard as we can, and we are already working as hard as we can to try and get those day procedures back on, and we'll update you when we're able to do that.
PM said this morning that it should be a last resort, that the National Cabinet earlier, I think maybe last year, decided that it should not be considered an elective procedure and IVF should remain until it absolutely needs to be cancelled. Was that considered when the government made the decision? And who actually made the call to delay IVF?
Well, there are orders that are made, and it's across the board. There are a whole range of different services that are being impacted. And obviously no one wants to see people unable to get the care and support that they need, and the care and support that they would, without a pandemic, absolutely assume they would be able to get. The focus here is not what's notionally decided at National Cabinet, and a National Cabinet makes no such decisions. That's not the way National Cabinet works. What's turned on and off, what's impacted, paused, expanded, is in every way a matter for the states. But there's no argument here. This is deeply distressing, very, very difficult, and it's already a difficult journey for people to be on. I appreciate that, I understand that. I've heard that message for a number of years now. That's why we committed to, as I said before, Australia's first and only public IVF clinic, which will open later this year, and we'll have more to say about that in due course. But the really important point here is that we understand this is distressing, and we're doing everything we can to get those day procedures back up and running, and I hope to be able to provide a positive update very, very soon. Sure, I can't provide people with a timeline other than to say this. We're working as hard as we can, not just on IVF, but on a number of other day surgery procedures, day procedures more broadly is a more appropriate term, to resume those where there's not that overnight stay, where there's less of an impact on workforce, and where Omicron versus Delta there is less of a safety issue. It may look a bit different, there may have to be screening and things of that nature, but we want to try and resume as many of those day procedures, which would include IVF, as soon as possible. And if I can, I don't want to cut across. There are processes within the Act that are different now than they used to be. But we will have, hopefully, positive news for day procedures more broadly very, very soon.
We're still a few weeks away from our peak of hospitalisations, like probably leading into it stands to reason that if something's cancelled now, it's not coming back until about a month from now.
No, that's not right at all. Sometimes things are cancelled because you have to assume the worst. Then you can further evaluate whether, in the context of not what was supposed to happen but what actually is happening, so modelling versus the actuals, and you can revisit some things. You can have a look at things and say, okay, actually in the context of the way this is panning out, the way it's working, we can have some day surgery back on. We can have some day procedures back on, particularly if they are in the private sector. So they're the sort of discussions, they're the sort of detailed considerations that we're going through. These decisions are always based on advice, and sometimes you have to err on the side of the worst case, but then as things unfold, you find there is an opportunity to be able to reinstate some services. And I think that's the history of so many different parts of the system that we've paused and then gradually reopened over the last couple of years. Again, I want to be as clear as I can be. I appreciate and I understand this is deeply distressing. I have listened to so many stories of individuals and families' IVF journeys over many years now. We're not looking to make what is already, in many cases, a very difficult journey harder. I apologise for the impact that the pandemic is having, and we will get those day procedures back on as soon as we possibly can.
I'll ask you, in relation to tennis and at the risk of getting an answer that I know you've said many times, are you aware at all who in the federal government granted the initial visa to allow that country to get?
No, and I'm not. I don't. As I said, I don't grant visas. Who in the Commonwealth Government did that? If it even is someone in the Commonwealth Government, it would have probably been the Australian Border Force, I would think. So not necessarily a minister. Again, I'm not looking to have an argument with whether it's Stephen Marshall or Alex Hawke. That individual's not here anymore. And as I've said to you a number of times, and I'm very pleased to be proven accurate, tennis is happening. Like, this event is bigger than any one person. And there's only one person who thought that it wasn't, and he's not here anymore. So the event's happening, and that's a great thing for Melbourne, it's a great thing for our country, and it wouldn't be happening if we didn't have 93% of people, 93% of people having been vaccinated. As I've said all the way through, just get vaccinated. That's the key. That's why we're having the Australian Open with crowds. It'll be run and won. It's a great event. It's much bigger than any one person. And the only person who thought it wasn't isn't here anymore. So we wish him well. And the tournament's happening. So I'm not interested in going back over all of that. My position's been very clear. Late last year, we would not be supporting an exemption. And we haven't. And he's not here anymore. I know I haven't, but perhaps the Minister has. Well, I've always worked very closely with Tennis Australia on many different things. Their team is a matter for them, but I know Craig Tolley. I've worked very closely with Craig Tolley over many, many years. But again, you know, who runs the tennis is a matter for Tennis Australia, so you need to speak to them. But I do note they put a statement out yesterday, I think, that made a few acknowledgements about where they're learning and all of that. I wouldn't disagree with that. But let's not have, like, I've tried to be clear with you. One guy is not bigger than this whole tournament, right? That's absolutely clear. So it's probably better that we don't obsess about something that's now basically resolved. Let's focus on the fact that there's a Grand Slam being played in our city, in our state. That's not happening anywhere else in the world. Like, this is the biggest thing in tennis in the first quarter of the year, and we should be proud of that. And there's been a process. People can reflect on that. You know, some I think have offered some pretty cheap commentary about how this has affected Melbourne's reputation. What absolute nonsense. Like, you know, we're running a Grand Slam. Tournament's bigger than any one person. It's been resolved. Let's move on. Let's focus on the tennis. Well, I would just say this. I don't think any Victorian would question how hard Martin Foley has worked. You guys have spent many more hours with him than he's spent with his family. Let me be very clear on that. So he has worked very, very hard, and I have complete confidence that the Deputy Premier, who is also the Mental Health Minister, so he's already in that department, is doing an outstanding job. Minister Foley has worked very, very hard, and we need him to be able to continue working hard like that all throughout the year. And sometimes a short break is an important part of that.
How is the private hospital system supporting a public system under both round? And when do you expect the peak of the pressure on the health system?
Oh, look, there are many different views and theories on when that peak comes. Some would see it as in the next couple of weeks. Again, modelling is only as good as the assumptions that underpin it. We've had that conversation, all of us together, for many times over the last couple of years. But that's our hope. The key point here is you can model, you can forecast. Assumptions are critical. Actuals are always much more important. And the thing that we can all, in actual terms, in real terms, do to impact when that peak happens, to impact the amount of pressure that's on our health system, the amount we have to pause and cancel some procedures in favour of those who are more time critical, urgent, life and death, for instance. That all depends on how many people go and get their third dose. It all depends on whether we all do our level best to follow the rules. There are not many of them, but we still have to try and follow them as best we can. And particularly, and this I can't thank enough, and often enough, those many hundreds of thousands of Victorians who are at home, isolating, not just for their safety, but for everyone's safety. We're deeply, deeply grateful to them. But the one thing we can all do, it's not about a model, it's not a theoretical thing, it's actual, it's real, it's impactful, it matters. Go and get your third dose. And with the booster blitz this weekend, there are more walk-up appointments, there are walk-up appointments. It's not something we've had, that's been a feature of the system. We have more cubicles open, more appointments, more spots. It's never been easier to get that third dose, and it's never been more important. In terms of the detailed way in which the private hospital system and the public hospital system works, I'm more than happy to have somebody from DH talk to you about that and perhaps give you some insights It won't necessarily have kicked into full gear now, but we worked as one system last year and certainly in 2020, so we'll be able to give you a few ideas of what that means on the ground. Well, there's always a hunger for having big major events in our state because they underpin jobs. And whether it's F1, whether it's Australian Open tennis, food, wine, all the stuff that goes on at the National Gallery, they're all critically important to the livelihoods of 250,000 Victorians. That's what that visitor economy is all about. And as we see Australia opening up, the world opening up, travel resuming, more and more people coming here because we're a safe place, a highly vaccinated place, one of the most highly vaccinated places in the world, those jobs are important. They've always been important to me and to us. So every day, every single day, we are out there chasing every worthwhile major event to support those jobs and to support our brand and our reputation and that part of the economy that's so important. So when and if I have further announcements to make about any of those sorts of major events, I'll be sure and be out here with you talking about them. Yep.
Spending's at lockdown level. There's no federal support, no JobKeeper anymore. A lot of businesses are saying this wave is harder than the previous ones in that region. Has your government considered any kind of short-term stimulus, maybe one more grants program just to get us through this wave?
Well, we're always considering different ways in which we can support the economy, communities, families. Just last week, we made announcements in relation to the extension of the commercial tenancies scheme. That's a significant scheme that supports commercial tenants and indeed landlords because it's about certainty. Like the last thing they want is tenants unable to keep being a tenant. So that's just one example. There may be further examples of support that we offer. We're always considering those things.
Cash grants?
Well, I'm not here to announce any of those, but we're always looking at ways in which we can support business. And again, dealing with the health challenge has always been the way in which you best support business, as difficult as it has been. But we've provided like in the order of $10,000 million in support. I know there's some out there suggesting that we haven't, that, again, political games when there's just no time for that. And there's no interest in that. People want to get on and get through this. And you best do that together. You best do that when you stick together. When we're united, we can achieve anything. Victorians have shown that. And this is tough at the moment. It's deeply inconvenient for so many people. It's very challenging. We'll always look to support people, but the best way that we can all support each other is to go and get a third dose. Please, for every good reason, for you, for your family, for the people we depend on, nurses, ambos, doctors, all of us, we've got to go and get our third dose, and it's never been easier to do that.
Is it a good look that we're the only city in the world that wants to host the Com Games by the looks of it?
Well, again, I'll leave you to make judgments about what looks good or otherwise. I've never been much of an expert on that.
There are reports around today that authorised officers were in trouble about fines. How many fines do you think?
I see what you did there. That's very good. No, it's a serious issue. The only briefing I have is that it's being investigated, being looked at by the Department of Justice and Community Safety. That's the only brief I've got. We're not certain yet whether it is a problem or isn't. And I won't speculate further than that, other than to say DJCS are looking at it, and if there's an update to be provided, then it will be.
Do you know how many fines were affected roughly?
No, I haven't got a brief about that. Again, you've got to work out whether first it is actually a problem. Then if it is, what time period does it relate to? And that'll be the answer to that question. So it's just a bit early for that. If and when that advice to me changes, then we'll provide you with an update.
If it is a problem, will your advice be that those fines be reversed?
Again, I wouldn't be providing advice on that, and I can't anticipate what advice I'll get. So I'd get proper legal advice on that issue. But again, I stress, I don't have advice that it is a confirmed problem. DJCS are looking at it, and if it is, then we'll have an update. Or if it isn't, we'll provide you with an update accordingly. Any other issues? If not, have a good day.
Go ahead, Steph.